Okay, so today we are going to learn about autism spectrum disorder, and this is going to be specifically targeted towards teens that have autism spectrum disorder. So first we'll talk about the characteristics of autism. So this is also considered the diagnostic criteria. So there's 5 different things that must be present in order for autism to be diagnosed. The first one is deficits in social communication and interaction. So this is a lot of things. The first one is there is a lack of social emotional reciprocity. So an example of this would be not being very good at having back and forth conversations, and maybe an inability to kind of make that emotional connection with somebody else. The next one is like a non-verbal kind of communication. This is so like maybe a lack of eye contact, not being able to read facial expressions, or understanding simple gestures, things like that. And then just developing and maintaining relationships, partly based because of those lack of ability to communicate. The next one is restricted or repetitive patterns or behavior of behavior or interest. So this could also be a few different things. Stereotyped movement. So I used to work with children that had autism, and an example of this would be I had a kiddo that when given a toy train, instead of playing with it in a functional way and driving it on the train track, he would just take the train and throw it up in the air over and over again. So just kind of a repetitive movement that doesn't really make functional sense, just over and over again, doing the same thing kind of over and over again. Inflexibility also falls under this category, like the insistence on the sameness, having to have the exact same routines every day, doing to the point where it's causes maybe a little bit of stress on other people, so having to have that like strict same pattern every day. And then fixated interests with an abnormal intensity. So it's normal for people to have certain interests that they really, really like, but typically in autism that's just magnified a little bit. So that could be maybe a certain movie, a certain song, a certain activity. I know a common one is like letters and numbers. So just being like obsessed with letters and numbers, and then nothing else, and wanting nothing to do with anything else but just loving letters and numbers, to the point where they don't want to do anything else. And then hyper or hypoactive sensory input. So it could be an indifference to pain, or it could be they have different senses. They experience things more strongly in different senses. So that could be a sense of like hearing. They might get really overwhelmed at the sound of something that isn't that loud. And then on the other end, like I said, kind of an indifference to pain, not even noticing something like that. The third one is the symptoms must be present in the early developmental period. It's pretty self-explanatory. And then it must be a clinically significant impairment. So just like any diagnosis in autism, also it has to, in order for it to be considered diagnosable, it needs to be clinically significant and actually affect their life. So that's kind of the benchmark. And then, of course, the last one is not better explained by anything else, or specifically an intellectual disability. And we will talk about what that looks like in just a little bit. So kind of going off of that. So similar diagnoses are some things to look at also to make sure that we're diagnosing the right thing. Rett syndrome. So where's that? Rett syndrome. So Rett syndrome is similar to autism, but it only happens between the ages of 1 and 4. So if the individual grows out of it after 4, then it probably wasn't autism. It's probably Rett syndrome, because autism is a lifelong disorder. Selective mutism. So selective mutism is different because the individual has the ability to speak, and they actually do speak in certain contexts. It's just certain contexts they don't speak, and they kind of shut down. And the what's it called? Yeah, the reason why they're shutting down is different than actually not being able to physically speak. Let's see. The next one is language disorders. So language disorders is specifically verbal language is what there's an issue with. So in autism, you also have that nonverbal component. You know that it's you can rule out language disorder if they also have that nonverbal component. Language disorders are specifically disorders for verbal language. So the lack of eye contact and not reading facial expressions is particular to autism. Let's see, intellectual disabilities. This is a little different. They don't have a social communication impairment. So this is all intellectual. And then stereotypic movement disorder would just be that category B right here. So, which is that restricted or repetitive patterns of behavior. They don't have the other deficits in social. They don't have the other deficits in language or anything else. It's just the repetitive. So, so a lot of these are just they don't meet the 5 criteria that they need to meet. And then ADHD. ADHD, it's all due to a lack of a lack of attention, I should say, and it's not at all attributed to any of those other 5 criteria. So there's certain ways, specifically that inflexibility, insistence on sameness, that it could be seen as ADHD, but it is. But ADHD does not meet all the criteria. And then lastly is schizophrenia. And schizophrenia is marked by hallucinations and delusions. So if there's not hallucinations and delusions, then it's, or if there's not hallucinations and delusions, then it's not autism. One thing that one of the articles did note about this one in particular is that schizophrenia, when diagnosing a kiddo, you have to be careful with that language deficit and the way that you phrase it. So the clinician might say to the kid, do you hear voices? And the kid might say yes. And they maybe, the way they're interpreting that is maybe they hear voices because they're also watching TV and they hear voices in the background. So things like that, that's how it can get misdiagnosed. So you got to be careful and make sure that you are covering all your bases when diagnosing. So, all right, going into who has autism and how common is it? So 1 in 59 children will be diagnosed and be on the spectrum. And it actually occurs in all races, cultures, and socioeconomic groups. So there's all kinds of research about what groups it's the most common in and all that, but most of the research kind of shows that it does happen in all groups, regardless of race, culture, socioeconomic status. It might be diagnosed more in certain races, but most of the research says that it is prevalent in all races, and it's present in all races. And it is 4 times more common in boys than girls. And it also has increased over the years. There's been an increase in awareness and diagnostics, which might be why it's increased. And from 2001 to 2011, it increased 3.5 times fold in 2 to 17-year-olds. So it has drastically gone up. The diagnosis for it has gone up. That doesn't necessarily mean that more people have autism now, just more people are getting diagnosed with autism. So specifically talking about teenagers, because that's kind of the target audience here, social functioning in specifically with teenagers. So we talked about how one of the characteristics is that difficulty in communicating, and that and another one of the functions is difficult with social interaction. So that definitely leads to, it affects the person's ability to make and form connections and relationships and have conversations, and their desire to want to have connections with people. So there's all kinds of research on what are some ways that teenagers specifically can combat some of this. Social skills training is something that there's a lot of conflicted research about. Some research says that having a social skills training kind of inhibits authenticity, and it also increases the stigma, but other research says that it is really helpful, and it can make teenagers feel better equipped to deal with social interaction. So there's kind of back and forth research on social skills training, but there definitely needs to be more research to understand that. And then there's also a misunderstanding of autism, specifically in teenagers, and there was also some research talks about how the media portrays someone with autism. Sometimes they're portrayed as like this kind of quirky genius, and that doesn't really grasp the full scope of what autism spectrum disorder is. There's all kinds of different people, all kinds of different personalities. So the media and the society in general doesn't always understand autism, and especially teenagers feel misunderstood. So talking about causes a little bit, all kinds of research saying that it's not environmental at all, it's definitely genetic, but there's a lot of debate about what kind of genetic. So it might be brain chemical abnormalities, or it could be, so a large amount of amino acid located at the blood-brain barrier, something like that, and then it could be genetic mutations as well. So that's kind of for debate still. And then treating ASD. So there is no cure. If you have autism, you will always have autism. There's no changing that. But there's all kinds of different things that can help make the person live a functional life with autism. Applied behavior analysis is a really popular method, specifically in children and teens. There's kind of conflicted research on this as well. It is definitely helpful, but it's also very rigid, and it's very, especially for kids, it can be very time consuming. It's 40-hour-a-week therapy that helps children and teens live a more functional life, and it's intensive, and it definitely is effective. I've actually worked for ABA for a year or two, and I saw it firsthand. It's definitely an effective form of therapy, but it's very intense. And then other forms of therapy and special education as well can be very helpful in treating autism spectrum disorder. And then there's all kinds of different research about psychotropic drugs and autism. There's different things, they say different things, but I would say most of the research doesn't really recommend drugs to treat specifically autism. Most of the research says that it shouldn't be, drugs should only be a part of it if there's another diagnosis. So if they also have schizophrenia, for example. It's usually with co-occurring conditions. And so there are no drugs that are approved for autism's core features, is what most of the research says. But there is some research that says that in certain situations, drugs that have been prescribed, anticonvulsants, antidepressants, antipsychotics, sedatives, hypointensives, and stimulants. So those are some of the things that have been prescribed, but from most of the research that I've seen, it's not recommended. So that is kind of the end of that. Hopefully you learned a little something about autism spectrum disorder, and got to understand a little bit what it's like for a teenager to have autism spectrum disorder.